My name is Bart, and today we're going to discuss about male infertility. Before I start, I want to thank you, Liam, for the wonderful job. It's so amazing to see how full the place is, and we believe that we're not gonna leave this place as we came in. We're going to be fed with a lot of information that can be helpful for our reproductive life. Thank you again for the opportunity. I'm a founder of ReproLab. ReproLab is an andrology laboratory, so we are busy dealing with male fertility, sperm analysis, sperm freezing, sperm donation, and those are the type of services we are rendering. But I'm also a consultant embryologist. Yeah, most of our embryologists usually they are in one lab, but I have privilege to be visiting different labs, and I'm so happy that I've gained quite a lot of experience and a lot of aspects of this job. Embryologist is such a stressful job, but it's also a fulfilling job, mostly when you are able to help the couple that are struggling from not having children to getting children. That is very important. So that's what we are busy with. So today, not wasting time, we're going to discuss about male infertility. Okay, male infertility refers to a male inability to achieve a pregnancy after 6 to 12 months. We believe here we are dealing with a female who is fertile. So after living together and aiming to have a child, but after 12 months maximum and there is no child, then we can start talking about infertility. But if that is infertility, what is fertility then? Fertility, it's a process, okay? So it has a multiple facet in one thing. It encompasses production of sperm. The sperm must acquire functions. They must be delivered in the appropriate place at the appropriate time within the vagina. We hope by then that there will be ovulation. The sperm need to meet the egg, fertilize the egg, which must result into viable embryo, which will implant, go to the pregnancy during the term pregnancy, and which result into delivery of a healthy baby. That is a fertile man. So when we have any challenge or compromise into any level of these steps, we will be dealing with what we call infertility. So after 12 months of trying to have a baby, now there is no baby, what can we do? First step when it comes to male fertility, semen analysis is the standard code. We need the men to come after 2 to 7 days of abstinence, come to our offices, produce a sperm sample which will be analyzed, and within 24 to 48 hours, the result will be available. Okay, let's talk first about statistics. Infertility in a male. Previous speakers mentioned it. 1 out of 6 couples at reproductive age are suffering from infertility, and that is worldwide. But if we go into underdeveloped countries, 1 out of 4, and those numbers are quite alarming. Infertility treatments are becoming more popular. More, even younger people, they are coming to us to get treatment. Male infertility is on the rise. Of 10 couples that will cross fertility clinic doors, 4 to 5 factors or infertility will be due to male factor. So male, we are not blameless, as the previous speaker says, but we are also part of the responsibility. So what can cause infertility in male? We have different reasons. First one, for example, varicocele. We have this big vein under the testicles, to overheating the testicle. The reason the testicles are outside of the body is because the sperm gets produced at a lower temperature than the body temperature. But if a patient is suffering from this condition, it means the testicle gets overheated, and that is going to compromise sperm production. We have infections, STDs, untreated infections, ejaculation issues, antibodies, where the immune system considers sperm as foreign material and attack them. We have cases of which we call cryptorchidism or undescended testicles. A baby boy, after born, the testicle need to go down from the abdominal cavity into the scrotum, but it might be 1 or 2 are stuck somewhere. And that can be the cause of infertility unless the situation is attended to on time, like within 1 year maximum that the child is born. There might be also a defect into tubules that must transport sperm from wherever it stored into the epididymis to outside. We continue, of course, but the previous cause I just mentioned, those are quite minor causes. You don't find them every day when patients come to your office. Sperm count or sperm quantity and the sperm quality, this seems to be the bigger problem that we are dealing with. By day we check the sperm numbers, the sperm shape, the movement can reduce the successful fertilization. So when the patient comes for semen analysis, we check these parameters. How many sperm do we have per milliliter? How many sperm are moving? How many sperm are having a normal shape? And we compare these parameters with a standard. From there we can tell whether the patient has potentials or there's no potential. But there's also, at the end of the tunnel, where we can assist. Hormones as well. Sperm production relies on hormones. We need like a testosterone, the follicular stimulating hormone, LH. We need balance in this hormone for normal semen or sperm production. We have also a problem of erectile dysfunction, which it's when the patient is not able to develop erection and sustain it during the period of intercourse. That also can be a problem because sperm is not going to be deposited at the right place, as we just discussed. There are also genetic abnormalities that can affect men and that can also affect fertility in men. We have, for example, the situation of Klinefelter syndrome, whereby men who are supposed to have X and Y chromosome, he has XXY chromosome. We have also Y chromosome deletion, and these two conditions can lead to sperm production problem. Usually we have low sperm production, and sometimes we don't even have sperm in that particular person. Age, the previous speaker just mentioned age is becoming a problem these days because Mrs. Right is waiting for Mr. Right, Mr. Left is waiting for Mrs. Right, and the time goes. Fertility is something that we have, but we need to maintain it. It comes and goes with age. Lifestyle factors. What we do every day, I usually say we are what we eat. So, male smoking, exercise, excessive alcohol consumption, drug abuse, poor diet, lack of exercise, not drinking water, obesity, all of these are going to affect negatively your fertility or male fertility. And we see that obesity is quite a big problem. It plays on the sperm quality, sperm numbers, and a lot of couples who have men suffering from obesity are really struggling to have their child. Anabolic steroids, people or guys who are really obsessed with bodybuilding, the fertility has been shown that they play negatively on the sperm production. And most of people, when you visit us, the first question we ask whether you are a bodybuilder, and often out of 10 bodybuilders that come in your practice, 8 or 10 will have problems because they've been using excessively these anabolic steroids. Environmental factors. Exposure to environmental pollutants, toxins, and radiation can also harm production of sperm. Okay, having said this, there is still hope at the end of the tunnel. How does one now preserve or announce fertility? Having a baby today does not guarantee that you will have a baby tomorrow. So you need to make sure that you preserve your fertility. How? By having a healthy lifestyle, balanced diet, regular exercise. Please let drink water as often as we can, and sleep is very important. Testosterone is being secreted or produced when you sleep. So the more you sleep, the more testosterone you can have, which is going to help you into sperm production and even prevent any situation of erectile dysfunction, for example. Avoid harmful habits like smoking can also improve fertility. Stress management. Stress is part of our life, definitely. We're not gonna run away from it. Imagine you are in this place and then you see a lion coming. Your lungs are going to go up. A lot of oxygen, you will be able to jump a wall and run. But if this lion is following you for 1 hour, you're going to reach the wall. So stress is there, but we need to be able to manage. How do we manage stress? Meditation, yoga, and do other things. Preserving and announcing fertility, we continue overeating. As I just discussed previously, we have testicles outside of the body. Consider, for example, truck drivers coming from Zambia to South Africa, sitting for hours, your seat get overheated and it exposes your testicles. That can be also a cause of infertility. Saunas, hot baths, tight underwears can cause problems. Most also when you go to bed, how do you sleep? I suggest to people to sleep with big clothes or just naked so that the body can breathe. Regular sexual activity. Regular sexual activities. Once sperm is produced, it goes in the epididymis, that is the center where sperm is stored. And if there is no regular sexual activities, the sperm stay there, and it's been shown that most sperm get damaged there with the DNA fragmentation. And so when there is regular sexual activities, it allows that sperm is not being stored for a longer time in the epididymis and is prevented from getting damaged. Okay, so that's how we can maintain fertility. But now we have situation where people visit us already, they're having problems, which we need to solve. So medical advances are being used today to help couples that are struggling. And we have the event of ARTs, assisted reproduction technologies. It includes the standard IVF, whereby just eggs and sperm brought together to facilitate fertilization. We have intracytoplasmic sperm injection, where one sperm can be selected under the powerful microscope and injected in the egg. So in this case, male with low sperm count can still get help. Sperm retrieval techniques as well. Sometimes we have case of obstructive azoospermia or non-obstructive. So this man, when he ejaculates, just a fluid that comes out and there is no sperm. So we go to the testicles and try to remove tubules there, or in the epididymis, we're going to suck the content and we have sperm. 1, 2, 3, which we can freeze, or we can use it fresh and fertilize the egg. There is also freezing of sperm that can be done, preserving sperm for future use. For example, when we have a cancer patient, you know, a cancer treatment can definitely negatively affect sperm production. So we advise our male counterpart to make sure before the treatment takes place, visit a fertility clinic where sperm can be collected and frozen for future use. People also who are working in high-risk profession, like soldiers going to war, you don't know if the person will come back. So we advise to get sperm. Not only there, we have also partners that are very busy traveling for business. The woman stay home, and then it's the D-Day, and the partner is not there. You can leave your sperm behind through cryopreservation, and you'll be able to do an artificial insemination and help your partner. By the time you come back, your baby is waiting for you. Stem cell research, there are research going on where we are trying to generate sperm from the stem cell, but this is still under research or studies. Genetic testing is very important because genetic already abnormalities can be part of male infertility, so we need to check what is the problem and see what appropriate solution we can bring. Sperm donation is there as well. In case that there is no sperm, we cannot produce sperm, so we can still ask the service of other good people who are willing to come in and help. More important, nutritional, pharmacological, and lifestyle intervention, very important. You are what you eat, so we need to be careful. Your soft drink, your too much caffeine, your smoking, lack of drinking water, all of those damage fertility. So if one can make sure we get enough vitamin, antioxidants, nutrients like zinc, selenium, or vitamin C, and vitamin E, it's been shown these elements are capable of improving sperm production and quality. We can also use fertility preservation for boys, for example, who have cancer at the early age. The testicular tissues can be frozen and kept, and later in life can be used to try and retrieve sperm that can be used. We also do sperm DNA fragmentation tests. Integrity of the DNA is very important because when the sperm and the egg meet, is the exchange, the DNAs that come together. So if the DNA is damaged, eggs, we struggle to get fertilization, or even when we have fertilization, the embryo is not viable. And these days, we have the artificial intelligence that is coming up, definitely is going to help us in andrology, and also in ICSI. It will tell us exactly which sperm to use, which will be of good quality to help the patient, as well as in semen analysis, because at the end of the day, semen analysis doesn't tell you exactly whether you can father or no, but it's an indication. But with AI, I think semen analysis, AI will help us to be able to pick up which parameters can be predictable for fertility. Okay, conclusion. Infertility can hit anybody, men included. Sperm health takes time, so we need to make sure we have a health lifestyle. It's not lifestyle for 2-3 months and thinking everything has been improved. No, it needs to be a way of life. Libido is not fertility. Your partner can last 3 months in bed. If you are not pregnant, you are not. So, delay fatherhood, it's also a problem. As we discussed, as the previous speaker says, we wait until the time is right, but the body is not waiting. We thought previously men can father any time, but now the research shows that no, there's quite a lot of abnormalities that comes in. So we suggest, or we ask our men counterparts to try and father as early as possible, and if you're not ready, maybe freeze the sperm, freeze your future, because if you are 20 and you freeze your sperm, then the sperm is 20 when you are 40. Medical advances solve majority of male infertility cases, although it's not going to solve everything, but majority will be solved. You just have to seek help. ReproLab is committed to turn dreams into families. That is our motto. Thank you very much for your attention.